Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. Have you participated in the open forums we've created to learn more about how we can advance equity and health policy with the African American community? If you haven't already done so, please register to share your voice during our next community information session, which takes place on Thursday, November 5th at 6 p.m. The Eventbrite link for this event will be provided in the comments section during our broadcast today. We will also be adding a third session at noon on November 18th. One more quick reminder, please sign up to receive CAA Health's latest updates by visiting our website and adding your email address to our e-news distribution. And as we wait for a few more people to join, I'll introduce myself and tell you a little bit more about the center. My name is Deidre Johnson, and I'm the CEO and Executive Director for the Center for African American Health. We have actually been working in the Denver metro community for the last 20 years, excuse me, with a focus and commitment to ensuring that African Americans have opportunities for health and wellness. As we move through today's session, please feel free to type your questions in the comment area and we'll address them if time permits. One of the lessons we can take away from 2020 is the importance of planning ahead. While we can't predict when a crisis will happen, in some instances, there are ways we can prepare ourselves in advance to minimize any negative outcomes. Now more than ever, health insurance is essential to protect you and your loved ones from high medical costs in the events of accidents, treating illness, and receiving preventive care. Last week, we discussed the concerning spike of the COVID-19 pandemic in our state, especially during the cold and flu season. This latest spike is even more concerning because it affects all ages. Today, we want to share information about the open enrollment period for health insurance so that you can protect yourself from health and financial risks. My guest this afternoon was recently named one of Denver Business Journal's most admired CEOs of 2020 due to strong and visionary leadership guiding companies through the unprecedented challenges posed by the COVID-19 pandemic. Please welcome back Kevin Patterson, Chief Executive Officer of Connect for Health Colorado. Kevin, congratulations for being recognized for your extraordinary accomplishment.
Thank you, Deidre. It's such a pleasure to be here with you and all of your listeners, watchers, and your community that we share. It's just an honor to be recognized in such a way. Apparently my dogs don't care that I was recognized. So if you hear them, I'll try to keep it as quiet as I can, but you know how this is. It's kind of the world we live in today. So it's been really fun for us this past year at the Exchange. We've had a great deal of challenge to try to help our state make it through. And hopefully today we can talk a little bit about the things that I think are important for your listeners to make sure they know as we are on the eve of our next open enrollment period. And we're really excited about ensuring our mission of increasing access, affordability, and choice for individuals and small employers as they try to purchase health insurance in Colorado. We just want to make sure that we're able to help people buy what's best for them. So you let me know how you want to roll, and I am good.
Sounds good. So as you mentioned, open enrollment for 2021 health coverage starts this Sunday, November 1st. It ends on January 15th. During this time, people will have the opportunity to compare different plans, shop around, apply for financial assistance. What else do we need to know?
So it's really important that folks look at that financial assistance and sign up between November 1st. They actually can go all the way through January 15th. What's really important though is we try to encourage people to make sure that they shop by December 15th so they have a full year in 2021 for coverage. They will remain open for those folks that can't quite get everything together until the first part of the year. So we'll have it till January 15th, but that coverage will start in February. So, we all want to make sure people are covered, especially as we begin to see the data showing that the surge is kind of coming back and the concerns that we're seeing in hospitalizations around our state and watching where these potential hotspots come up. So we want to make sure that we have every opportunity for folks to get the coverage that they need, just so they're not caught in a situation where they have these huge bills that they will have. So it's really important. You know, we have certified application enrollment experts, including the center, that are doing things on video, through phones, socially distanced in-person appointments are also being done to help uninsured Coloradans make sure that they can sign up for health insurance. And, you know, if you want to make an appointment, you can come to our website, connectforhealthco.com, and click We Can Help. We can certainly get you connected to someone who's in your community, someone that's close to wherever you're living. And because we are the only place where you can apply for that financial assistance that actually lowers the cost of health insurance. And I think one of the things that we find out so much is that people are like, well, you know, I actually have a job. I don't necessarily get health insurance at work, but I don't qualify for anything. And I think people tend to get that one wrong. And so we know that people that are making up to $51,000 a year for themselves, or a household of four making $104,800 annually, could be eligible to lower their monthly premiums, get healthcare discounts, or maybe both, depending on where they fall. And when people figure that out, they're like, wait, I actually qualify for that? And they're able to take what is a sometimes $500-600 a month premium and get it down to about $115-130 a month. And so that makes a huge difference to families as they're just making things work. You know, in our data last year, we were able to get over $700 million of tax credits in Coloradans' pockets because we were able to lower their premiums by that much across the state. And that's for like 74% of the people that we have as enrollments that are financially assisted through the exchange. So we want to make sure people take time to look at all of their options, make sure they're shopping for the plans and the prices, because all of that changes every year. And so they can do that online at the website that I mentioned. They can call us by phone, 855-752-6749, or the virtual appointment with an enrollment center or an expert, which is, again, connectforhealthco.com/We Can Help. That's an easy place for folks to figure out where they can go.
Can you just explain a little bit about the importance of having health insurance?
Yeah, you know, you talked about it a little bit. It really is about protecting your health, but also protecting your finances. And I draw this analogy a lot. You know, people are like, hey, Kevin, I bought that health insurance and I didn't feel like I got my money back. And I'm like, money back? I said, that's an interesting way to think about it. I said, so you have car insurance, right? And they said, well, yeah. I said, you financed your car? Yeah. So, okay, you got comp and collision, right? Yeah. Okay. So for you to actually use your insurance for your automobile, do you take off your seatbelt and run into something so you can use it? And they're like, well, no, Kevin, that doesn't make any. Oh, I'm like, yeah, it's not about the fact that you are planning to use it, other than, you know, hopefully getting your well care and making sure you're doing your checkups. But if something does come up, we want to make sure that if somebody has to go to the hospital, you know, they don't necessarily realize that an average 3-day cost for a stay in the hospital without health insurance is around $30,000. And so and again, that's average. That means it could be a little lower, but I've seen it where it's much higher. And so we just want to make sure that people are actually protecting their financial well-being, because since the implementation of the Affordable Care Act, we've been able to see medical bankruptcies, you know, cut more than in half in our state. And so we know that those are real issues that folks are dealing with. And so I think it's extremely important for people to understand how their health insurance actually benefits their financial stability as well.
You know, there's a lot to navigate, especially when people hear marketplace. Some people get nervous. What does health insurance through the marketplace really mean, and how does it work?
So what's different about it, and why we typically call it a marketplace, is that it is private health insurance. And so while it is a federally authorized program, you're buying private insurance from a carrier or an insurance company to make sure that what you're able to buy is taken wherever that particular company has a network. And so it's really important for folks to know that when they're buying something, they know what they're getting. And so coming to us, we're actually helping them buy health insurance. We're just lowering the cost. But it's also really important for us to come and help them explain how they want to use it, what the different terms mean. What I think is, what I hate to hear the most is somebody say, yeah, I have the insurance, but I just couldn't figure out what all these words are, so I just didn't do anything. And I'm like, well, that's not the way we want it to go either, because then you are paying premium, you are guaranteeing, your coverage, and you should be able to use, like I said, the well care, making sure you're doing your checkups, getting everything done, keeping yourself on a right kind of regimen so you have the best health you can have, and be there for your family and your loved ones. And so when we talk about it that way, it's about that private health insurance and making sure that we are the official place to show those plans and get that financial assistance. But you also can see it from multiple health insurance companies. And that's what's really unique, is the ability to see all of the carriers that are operating on the exchange. And there's, 8 insurance carriers in one co-op that's in 2 different locations across the state. And so we're really proud of the amount of options that we're able to have increased in Colorado.
So there are many people who lost their jobs due to the pandemic. And it's interesting, I recently read somewhere where they anticipate that even 60% of those businesses that closed during the pandemic will never open again. So what advice can you provide for someone who experienced job loss for finding adequate health care?
I think it's really important for those folks. Well, let me tell you this story first. One of the things that I heard after folks were starting to lose their jobs through the first wave of the pandemic, people would come to me and say, Kevin, I'm just not sure if I want to buy health insurance that's tied to my work anymore. And that was the first time I had somebody actually come and, without me offering this as an option, say, this is what they're really thinking about, because they're looking for something that's portable, that they can carry with them, and that's not necessarily tied to where they're working. And it happens a lot with folks that are working hourly and sometimes multiple hourly jobs. Yeah. Some of those places can't afford, they're just really small businesses, and they can't afford to offer a great health benefit. And so, the place for us around what we can do at the marketplace is actually give them a portable option that they can carry with them wherever they are, that might be based on what they're being paid, that gives them an ability to actually afford it. So I think that's one point I just wanted to have out there. But if you do lose your job and you lose your health care there, it does open up what they call a special enrollment period. So you have 60 days to come to Connect for Health Colorado, look and see what what you might be able to afford, and you look at what you think you're going to make going forward. And so people tend to estimate that, and they come and they say, this is the plan I think I can afford. This makes sense for me. They're able to actually have that coverage and hopefully not have a break in coverage. And so that's really important to look at. The other thing that I've heard from a number of folks is because we are that place where you can apply for financial help, we're often more affordable option than even COBRA for some folks. And so we've seen folks that have come in and they said, this COBRA number is much higher than I thought it was going to be. And we say, well, have you looked on the exchange and see what you could afford there? And they're able to find, typically, mostly in the metro area, they're able to find something very easily that fits their network so they can find their doctor and continue their care as they continue to move forward. So anytime a Coloradan has some sort of experience where they're losing their health coverage, they just need to talk to one of the experts that we use. And so I think the center is one great place that you can go in and speak with an expert. But we also have enrollment centers that have brokers. We have certified application centers that are in different clinics and sometimes in hospitals. And they may go into Colorado Health First. They may go into the Child Health Plus Plan Plus CHIP, or they might come into our enrollments. And so, we're agnostic. We just want to make sure people get covered.
Okay. So when comparing insurance plans, what are some things people should take into consideration?
So I think it's really important for folks, while premium tends to drive how people look at it, it shouldn't be the only driver. And so you have to understand how much you think you're going to need the care. Do you have prescriptions that you regularly have to make sure that you get? Is there a doctor that you've been seeing you want to see, or some sort of service that you want to make sure you need? And so for that, we have a tool on our website that allows you for free to kind of just look at the plans before you actually go through the application. And so you can go to our website and click browse plans just to try it. And then you can kind of just look around and see what's close to you. It'll tell you by where you are, zip code. We can kind of help you hone in on where you think you're going to need your services. That way you can kind of look around and see what it is before you actually make the decision to buy, just so you can do your research, make sure you've got a level of comfort that you know that you're buying something that you think is going to fit for you and your family.
I remember comparing what are the urgent costs in emergency rooms, because as a mother of boys, between skateboards and sporting accidents.
Yeah, they tend to be clumsy.
Are there options for people to change coverage after the open enrollment period if the plan they select no longer meets their needs?
The simple answer on that one is no. That's why I think it's really important as people go through. You can change your mind up to December 15th. But after that, you've kind of locked yourself in for the year. And so what I try to help people understand is it's a contract between you and the insurer. You're telling the insurer, yep, this is the plan I'm going to pay for the rest of the year. And the insurer is telling you, yes, this is the list of services you're going to get for the rest of the year. So you've made sort of that agreement in a contract. And so that's why they call it the binder payment, because it actually binds the contract between the customer and the insurance company. So once you're in there, you're kind of there. And I think that's why I speak so much about why it's important to speak to an expert like the center to make sure that you are able to find what actually would fit your needs as a person or for the family. So it's just really important to know that, so that when you make the decision, you know that's the one you're going to have for a year. But if you're comfortable with it, you're good with that. So we just want to make sure people get the information that they need.
So I was actually asked a question yesterday. So this is new to you.
Fine.
And it was regarding, if things go sideways, Supreme Court wise, would it affect anything that I've signed up for the coming year? And I told this person I would doubt it, because it takes a moment for things to trickle down, but that was just Deidre making that assumption. And so I'd love to ask you your thoughts.
So yes, we tell people that, right now it would take, let's assume the worst thing happens. It would take some time, I think, to figure out how to unwind it, even if it got to that point. I think there's so many variables between that today and what that decision that it's hard to say there's one path that could take. I think there's so many different paths. It's hard to have a good way to project. But since this is the third or fourth time I think we've talked about a Supreme Court case since I've been here. Mm-hmm. I was in DC when the House voted to get rid of the Affordable Care Act. I mean, I've just seen this so many times. I'm like, I'll wait. There's been this big back and forth and this big political fight around this. I don't see it. I don't see anything happening on the negative very quickly. But I tell you that if things, I've explained it this way to my board and my staff. I said, we've done a really good job swimming against the current with this current administration. And we've been really successful at being agile, adaptable, creative as a state-based marketplace in ways that I think other state-based marketplaces are trying to learn some of the things that we're doing. And we're trying to learn some great things from them as well, don't get me wrong. But if things change and we have a different administration, swimming with the current doesn't mean you have full and total control either. And so I think either way the election goes, whatever happens with the court case, we're going to have to figure out how to manage it, because it will be different in some shape, form, or fashion than what we're doing today. And I'm really proud of the work that we've been able to do with the Polis administration here at the state level, and working with our legislative delegations here in the state, because they've actually found ways that they can leverage what work we've been able to do as a state-based marketplace to do things that are in the Health Insurance Affordability Fund and the Public Benefits Corporation that we've taken and created our own little for-profit entity to do things that we can't do as the technical exchange under federal jurisdiction. And so we are just finding really creative ways to do what we think makes sense for Coloradans in a way that actually goes back to the old Owen's Commission 208 Commission report that talked about creating a connector. Now, the context of what the connector was doing back then and what we can do today is different in terms of the tactical pieces of it, but the concept of having one place to go for individual insurance that's not tied to work is really what I think we've tried to create in Colorado. And it actually was part of what they tried to create out of the Affordable Care Act. It's like, look, if you're not getting healthcare at work, let's figure out a way to do it in the individual market. And that's really what I think we can expand ourselves at the exchange to do.
So really, people don't worry about the news right now. Just make sure you and your family have coverage for 2021.
That is, I think, the most important thing we need to make sure people understand from this conversation is whatever we're doing right now and all that stuff you're seeing on the news, you got to get your health insurance because we still are in the middle of a pandemic. I think, we've got to make sure folks understand that, when we opened up our special enrollment period in March, I didn't think we'd get 14,000 people coming in. So it was a much bigger number than I thought. And, a number of us around the country, as we've talked to other state-based marketplaces, because that's the next call I have right after this one, people are thinking, we might be really busy this year. And I'm thinking, yeah, that would make sense. So we're just trying to be prepared for as much as we can because we don't control any of it. We just try to make sure that we're able to respond in a way that's most advantageous for the customer base we're trying to serve. And that's just families needing health insurance.
I want to thank you for what you do because it truly is times like this where those systems you took for granted, you're glad they're there because if they weren't, Lord only knows where we'd be.
Yeah, it is kind of a scary thought.
So we're almost out of time. And I just wanted to share a resource with our viewers. So as mentioned, the Center for African American Health is also a Connect for Health Colorado Enrollment Center. And we can help you find the plan that meets your health and financial needs. For appointments online, go to caahealth.org/health insurance. Let's see, okay. And, I think, unless you have any parting thoughts for us, those are the questions we have for you today. I really I know how busy you are, and I appreciate you coming back for a second time to talk to us.
Happy to serve any way I can. I have a great affinity for the work you all are doing. I consider you a great colleague in this work, so I appreciate being asked to come back. So I don't have anything, I think, specifically I wanted to say. I'm happy to see if we've got a couple of questions, but other than that, that's really what I wanted to get to today.
Wonderful. We didn't have anything new come in that we hadn't already addressed.
Good.
So we'll go ahead and wrap up. Again, thank you again for joining us, Kevin. This video will be available along with other information on the center's website at caahealth.org. Join us next week for a Facebook Live Lunch and Learn for post-election day discussion with Halisi Vinson. Oh, and along those lines, if you haven't voted yet, please do. Have a wonderful weekend.